Dr. Kazaire, we want to welcome you to take to the podium to tell us what is happening down where you are. You're welcome.
Thank you, Madam Brenda, Honorable Minister, the ambassadors in the House, dear distinguished professors in the House, the Vice Chancellors in the House, all distinguished scientists, ladies and gentlemen, all protocol observed. Kazaire Health Products is an indigenous pharmaceutical company purely dealing with the natural therapeutics, and we are as old as Kota essentially, because I started in 1999, and I'm delighted in the House to see one of the people who steered what you see in me and what you see on the market under Kazaire Group, Professor Gwang, in the House. Because he was a young man at the Natural Chemotherapeutics Research Institute at the Ministry of Health, which was by then, I think, a small laboratory. It was a Natural Chemotherapeutics Research Lab. And he was there together with Dr. Grace Nambatia. I don't see her around, but she normally graces such functions. And these people, recently when I was with Professor at Mbarara University, he's one of my supervisors for my PhD in medicine, which I'm doing at Mbarara University of Science and Technology. I told him I will always not only call you professor, but I will always say father of natural medicine. Why? These are people who stood to be called witches, because since until before 2019, any scientist, even him the professor, who was doing any innovations in natural therapeutics, was being guided by the 1957 Witchcraft Act. So meaning, I had served a long time with him and other scientists as witches. But today, thanks to Uganda, that's why I'm grateful to the leadership of the government of Uganda, that by 2019, the traditional medicine bill, the Traditional Medicine and Complementary Medicine Act was put in place, and today we can say we are scientists. And I think it was not a small mark, because this was bringing regulatory hurdles. While we did a lot of innovations, they could not be regulated by National Drug Authority, who is the regulator. And they would say, what you are doing is witchcraft. We cannot regulate you. Here in Uganda, it is a criminal offense to practice in what you are doing. But thank you, you kept leading us, and thanks to the government and the leadership of Uganda, that by 2019, when the whole world believed there was a new way of doing things, that your knowledge you had preserved was called into action and is now legal knowledge. And that it can now contribute to the pathogen economy. So what was witchcraft is now seen as a journey to freedom, and economic reliance of Uganda can be now achieved. It is not only looking at that, but over the 25 years of our practice in natural therapeutics, we have come to a level whereby upon regularizing the practices, beliefs, and traditions of all traditional medicine practitioners who are now called indigenous scientists, we were able now to have space to breathe, and as scientists, bring out all the scientific protocols that have led us to a level where now I can present my product to Professor Chilenga, who is here in the House, one of the serious researchers in this House. And he can receive my product and say, yes, you are talking some science, it is there. Because we have now legal framework, and we have support of government. And I think, as one of my brothers said, what we are working on is not only for Uganda, but we are looking at the 1.2 billion, more than 1.2 billion on the continent, which is still being marginalized, still being pushed, and our science still being looked at something that cannot be of value. One of the key things is that in the natural therapeutics, the value chain, when you analyze how many people will be engaged in the planting of the medicinal plants that we are using as raw materials in our value chain, you find that medicinal plants will be commercial plants. Today, aloe vera, which was once a herb known to be in the bushes in the western Uganda, today is a commercial plant. People have established commercial plantations. They deliver it because we have established protocol that can be used to extract aloe imodine, which is a known active compound, which we are using in one of our formulations for its bioactivities. We have not stopped there, but our role at Kazaire Health Products is focusing at standardization of natural medicine. Aware that more than 60% of Ugandans, they are still using herbal medicine. Whether they go and pick conventional medicine from the hospitals, they end up using any means. They end up also going to access herbal medicine. So if the role of National Drug Authority, our regulator, is to provide safe, efficacious drugs, then the journey should not be to push away and shy away from this, but to call on scientists to join these indigenous scientists so that we can standardize these drugs. Lucky enough, the WHO guidelines for standardization of drugs is now available, and National Drug Authority has tried to benchmark it and bring it to customize it to our national requirements. And it is through this that we are able to do acute safety studies, and we can also do sub-acute toxicity studies on a product. We are able to do HPLC profiling, and we can do identification of active compounds. We can do both pharmacokinetic data on any formulation, and once all this is presented, then a product can be looked at, and its safety and efficacy can be assessed. One of the two products that we have worked on is Vidicin, which has gone through phase 2 of the clinical trial. I don't want to preempt the work of Professor Chirenga, who is the lead member. He was the PI of all that work that was done, and being done on a natural product designed from the bush to our labs, to our production line, and brought to his desk for analysis. And from there, we believe the data will be shared to the regulator, National Drug Authority, who will finally have us registered, and our product can be accessed at every level. And on this journey, we will have a lot of scientists who will be engaged in the process. We will have a lot of communities which will be engaged in the planting of these medicinal plants that we are using. But also, we are also embracing biotechnology for most of the endangered species and the rare plants. I'm working, one of my researches which I'm doing at Mbarara University of Science and Technology is making sure that I can extract cells from the plant, and I can use a bioreactor, and I can elicitate the process and cause this plant cell to continuously produce the metabolite of interest, which I am focused at. That's why bioassay-guided fractionation and phytochemical analysis is so important for us in the natural therapeutic sector. And we believe that the support we are getting continuously is going to lead us to reach where we are going as a nation. And I wish to thank STI for the commitment you are putting. When you go there, you see each person exhibiting various technologies, various forms of science, and you have not rejected any. And I learned that from Professor Gwang. He said, what you do not know does not mean that it is not existing. And my dear professor, that's what I practice every day. I believe that what I do not know, maybe someone knows it better. And it has kept me to be a continuous student, learning, even after an experience of quarter century in the natural therapeutics research. I want to thank you for your dedication and for supporting this initiative that will see our country to greater heights for God and my country. Thank you.
We shall give only 2 questions from the audience. One hand is already up.
Thank you very much. That was a detailed presentation. As you kept thinking, my mind kept going. I had a lot of hierarchy and guardrails or gatekeepers for you to qualify to be your paper, scientific paper, to be published in scientific science preview. It takes a lot of effort. Now, that comes from building institutions. I'm a student of understanding institutions and institutional dynamic. How do we make sure that we establish our strong institution, that Africa can build a scientific, an Afrocentric scientific institution, that we publish our own scientific review papers that are respected? My second question is, do we have an idea on, we see Silicon Valley in the US promoting technology and all that. As Africa, with a lot of biodiversity that are medicinal, can we build a valley or a mountain that give a social structure for all scientists where they can go and think and innovate? Because I've interacted with scientists that are people who don't like hierarchy, they don't like bureaucratic. Is there a possibility where a scientific person can go with a scientific thinking, get a rich social structure where they can innovate that is based here and looking at all over the continent? Because when you're going to provide scientific solutions, they are very expensive. Looking at Uganda, 45 million, you may not have enough market. That building that require collaboration. Are we able to collaborate as a continent and build that rich structure where scientific come and think, and we know that the solution is targeting 1-point-something billion population, and that will make it more affordable, and that also will earn us another extra market, because people are going to be respecting that.
Okay.
But achieving that will require collaboration. Thank you very much.
Thank you. One key thing that we must understand, long time ago, many people had not understood that disease was business. But I'm grateful to the deeper explanation of the government of Uganda to let scientists understand that the disease is business. And that's why my brother is talking about numbers. Me, for the last 25 years, I've been in business. Business is not about being busy. And it is a disease for most scientists. You be in the lab, you are busy up and down, you finish a certain study, then you publish, then you hang on the notes board, then you walk that evening like this, but what has come to your pocket? That's why I love Professor Chirenga. He emphasizes that monetizing research. So once scientists in Uganda get to understand this, that everything you are doing, before and also I learned that also from Professor Gwang, before he goes to the lab, he's telling you the product he's intending to put to the shelf. Along the journey, if he fails, that's okay. As a researcher, you should be expecting a yes or no. That's the way forward if you want to avoid bias in your data. And most of the time, this is how it has ended. The moment I remember in 2000, when I put out my first version of Vidicin, by then I was calling it knockoff. I had only $10 in my pocket, and I had to make a decision to start. The biggest challenge when people hear Mr. Magora has been allocated how many billions in the budget. They do not know behind that, before that time when you are being allocated funds in the budget, what did you go through? So, that is one thing we must focus on. And again, some people, when they find Kazaire health products everywhere, they again feel like Kazaire has taken the whole of it. No! There are still so many problems in society. That's why when I meet Professor Gwang, I still learn from him. He still teaches me. As he's teaching me, he visits my facility. He's also learning from me. So we have a challenge of scientists in Uganda who want to keep their small innovations under the armpit. It will grow more while still under your armpit. We must open. The first time I met with Professor Chirenga, he was so excited on how I was open about my science. My brother Dr. Magora said, science is facts. So put the set of facts to the scientific world so that they can understand you. Then we standardize our work to meet international standards. Then money will flow in. At all costs, the pathogens that have been a burden to Uganda will finally turn into an economy for Uganda, where the whole of Africa will be focusing at Uganda for their pathogen solutions. And with that, I hope our economy will grow and we will stand out, as we normally say, that for God and my country. Thank you.
Wow, wow, wow. A message very, very well delivered.